Okay, and so my name is Jake Rankin. I am the founder and CEO of Talem Home Care and Placement Services. So we do non-medical and home care, senior placement services, and then I also sell franchises nationwide. But today I am here talking to you guys as the president and chair of the board for Love Thy Neighbor Foundation. And so some of you may have known Al and what Al and Eileen have been doing for the last 6 years, which has been fantastic work doing their workshops and manning their information and resource hotline. But I think it's time to kind of evolve, change, and kind of move things forward even more based off of those building blocks that they've built so far. So today what we're going to do is we're going to talk about, maybe, one. There. We're going to talk real quickly about the history, the mission, the vision of Love Thy Neighbor. We're going to talk about what we view as the problem with the elderly and how the elderly are navigating and staying home safely. Then we're going to present to you our solution to the problem. And then we're going to talk about the future of Love Thy Neighbor, what that looks like. And then more importantly for you guys, if you would like to be involved, how can you guys become a service provider for Love Thy Neighbor? Our mission at Love Thy Neighbor is, at Love Thy Neighbor Foundation, we have a deep-rooted commitment to our core values, community love, and the spirit of family. Our mission is to provide empowerment, support, and education to the elderly and their caregivers, assisting them in navigating the complexities of aging in place with success. Like Al said before, it's really hard finding resources and understanding how can you stay home safely. And that's kind of like basically at the heart of everything we're trying to do. So our vision, how we're going to do this, we really want to be highly regarded as an esteemed centralized hub, a central point of coordination, supporting the elderly and their caregivers. And our vision is a society where adults age in place with dignity. They're empowered by the support and resources that we provide here at Love Thy Neighbor. Our core values and how we live up to it, we say that this is something new for Love Thy Neighbor, but we say that working with the elderly, working in the senior care industry, doing what we do, it's our calling. And our calling is how we're going to move Love Thy Neighbor forward. So we're going to do it through collaboration, advocacy, love, helping improve life, independence, sharing knowledge, and goodness. Knowledge. Yeah. So on the leadership team, we have our executive leadership. Well, obviously, we have Al. I'm going to get Al some new business cards. So his title is going to be Chief Mushroom moving forward. And say, why a mushroom? Well, because he's a fun guy. He's our chief mushroom. He's a fun guy, right? He's the founder, the brains, the heart behind it, and everything. And he's the inspiration, is going to continue to be the inspiration for Love Thy Neighbor moving forward. As you guys know, I'm president, chair of the board. I do hold a master's in business, and I am also a certified senior advisor, and I've been working in the elder care, senior care industry for close to 20 years now, across multiple states. I've been here in Wisconsin since 2015. I look at Mary because I think I met Mary in 2015 when I moved here. Randy Wesley is also our vice president of the foundation. So Randy's background, as we know, case management. He's also, what people don't know is he worked a lot in the insurance and was a co-founder of which insurance? Abri Health, that's right. Oh, if I just look there, Abri's insurance for Medicaid and HMO plans. Then I convinced Mary to come out of retirement to help us because I won't do anything without her. um, Mary, as you guys know, has been working in the industry for over 40 years. She's our secretary on the leadership team. Our treasurer, there's a good picture of our treasurer there. You know, we do not have a treasurer yet, so we're currently on the search for a treasurer. To be the treasurer, we will be doing our own accounting and bookkeeping, but we do want a treasurer to oversee us and hold us accountable to make sure we do things appropriately in the right way, particularly if and when we start getting grants. We want to make sure that we do things the right way. When? Yes. And then we have Allie Van Bogart, who currently is going to be working as a volunteer, helping move this project forward. There's a lot of moving pieces with this project. The problem as we see it, as you guys know, no shocker there, the aging population, those baby boomers, there's just a wave of people that's going to need help. And so they're predicting by 2030, there's going to be over 71.5 million people over the age of 65. We're going to do this because that population, in particular, the 85 plus population is increasing faster than ever, where people are living longer. It's just going to be a huge need and a huge growth for services. We also feel studies and research tell us that over 85% of the people who are 45 and older, where do they want to age? At home, and for as long as possible. Now, that home could be an independent living community. That home could be an assisted living community. It could be just where they grew up. But they want to live at home for as long as possible. And we all know that these independent living communities and assisted living communities, they're getting filled fast. A lot of them are. Memory care is getting filled fast. There's not enough senior communities out there, and it would take too long and cost too much money to build all. So home services is kind of where things start for that aging population. The problem, as we see it, you know, in order to age successful, I did a lot of research on this, and I actually do have references if you want to see them. But the kind of consensus that I see in all the research that I've done is in order to age successfully in place, there's certain things that have to be in place. Communication, medication management is massively important, fall prevention, infection control, caregiver support, and social engagement or socialization, you know, to help combat loneliness, isolation, depression, things of that nature. So those are the common themes that are needed, but there's challenges to accomplishing that goal as we age in place successfully. We've got a fragmented healthcare system, right? People jump around from this company, from this hospital to the nursing home, to this company, to that company, with a lack of coordination. Communication and information oftentimes is sparse. I've been victim of when I was trying to help my mother, getting conflicting information from doctors, 2 different doctors giving conflicting information, nurses, discharge planners, people who don't understand. Sometimes these discharge planners from the hospital, they work really hard, they're overworked, they do great work, but they don't have the time to learn about the resources that are in the community oftentimes, right? And so as people get ready to discharge home, they don't have the information. And the communication between the two is oftentimes lacking, particularly between their primary care physician or their family members. Access to care is another barrier. They may not know what resources exist, and this is why Al started Love Thy Neighbor Foundation, right? He wants to connect people with the resources to be able to stay home and age successfully in place. But right now, where do people go to get that information? The ADRC is a good place if they know about the resource, because sometimes they don't take your meeting. But everybody's limited to the capacity, so it's always helpful to have another place that people can turn to in addition to the ADRC, right? We've noticed improper care transitions, people transitioning from the hospital to rehab and rehab to home, and those result in rehospitalizations, which obviously people are focusing on right now. But in my opinion, I don't think they do it right. Even those care transition nurses, some of the problems with that is they have a limited time to follow up because they can't help everybody, right? And then there's just an overall lack of coordination because there's so many moving pieces. These family members get stressed, they don't know what to do, and there's just a lack of coordination because they're trying to follow what the hospital discharge planner said, but then what the nursing home discharge plan social worker said something different as they discharge, and there's just a lack of coordination. And the education they get at this level, they either start over with the same education, they don't pick up where they left off, or they get completely different education as they go on. And so there's just a lot of challenges. Nobody's to blame for it, but there's just a lot of challenges out there. So the question becomes, if you have all these challenges, how do you solve that problem? And so, again, research shows, I can share my research, that there's several different models that you can take to try to solve some of those problems. One is the primary care-based model where physicians are involved, and the physicians are the center point to all the care surrounding that aging person. But that tends to be limited in nature, and oftentimes, again, the doctors and the nurses at the doctor's office don't know all the resources. There's a case management model, which I think is probably the best model out of this, right? Where you have a case manager, a nurse, a social worker, a certified senior advisor, helping people guide and navigate and figure it out. The problem with that oftentimes is these case managers, A, cost some money, so you have to have money in order to use them, right? And B, they can be oftentimes centric to, I've seen nurse case managers really manage their caseload based off of around their vacations and around, sometimes you just don't get the best care sometimes. So I'm not blaming anybody in this state, but I've seen it in other states for sure. Then we have the care transitions model. So you take a look at the Dr. Eric Coleman model of care transitions, which I was lucky enough to sit in his focus groups. Dr. Eric Coleman is out of the University of Colorado. And when I lived in Colorado and started my company there, I was lucky enough to sit in some of his focus groups, learning on how he created his and why he created his care transition model. It's a great model, but everything I feel needs help, right? Then you take a look at the Naylor model, you take a look at all the different models. The problem with that I see is when they're coming out of the hospital and you have these care transition nurses or specialists at these hospitals, they're only following up once, they're only following up twice, maybe 3 times. Very rarely do they do a home visit in these care transitions, and it just leads to all those problems that we talked about here. Team-based models is something we see, but it's a great concept, creating an interdisciplinary team. Where do we see an interdisciplinary team? In the hospice world, right? Hospice world will have they have doctors, social workers, chaplains, they have volunteers. They do a great job of creating an interdisciplinary team. Why does it only have to be when you're in hospice to get that approach? Or some companies might try to create that, like the Aurora healthcare system might create that internally, but there's always going to be holes, in my opinion, on when you create that interdisciplinary team if you only limit it to those within your corporation, right? Because one corporation can't be everything. They don't do the hearing testing. They don't do the, things of that nature. And then there's the technology-enabled models where there's AI and things you can put in the home to help manage the care and collect that data, but that's still in its infancy. So what do we do about this? Well, our solution is going to be love thy neighbor. We want to be that central point of coordination, helping people as they navigate these independent silos. I'm sure some of you have heard the concept about healthcare is very siloed, and people tend to fall through the cracks as they move from hospital, assisted living, elder law attorneys, needing hearing aids, whatever the case may be. Because what? These service providers or these entities are so narrowly focused on what they do, oftentimes they don't take the time to look holistically at the other problems, that might be facing. If somebody's dealing with blindness or vision issues, can we take a bigger step back and see what else we can do holistically within the home to help this person age successfully? The problem is that hearing clinic or that vision clinic they don't have time to go do home safety, assessments. They don't have time to take a look at everything because there's just a lot of people that need help. If you can tap into a resource like Love Thy Neighbor to help you out with our continuum of care, that's going to be better. So I call it, this is my verbiage, I don't know, I'm calling it the village model because we've all heard the term, it takes a village, right? It takes a village to help take care of these seniors and these elderly people within our community. We're creating a central point of coordination. We're going to try to. This is the goal, where there's going to be a hub sharing information with a whole team of people, right? An interdisciplinary team of people to say, this person needs help, this person needs education, what can we do to help them? It's basically a combination of the care management model, care transitions model, and the team-based model, right? When we add care managers to answer this INR hotline, right, the care manager is going to take the time and actually provide some case management or care management to figure out what the problem is. If we can raise enough money and get enough funding through grants, we can continue to follow them through whatever they're faced with and not just talk to them once and then pass them off. That's the ultimate goal. Care transition models, at Talem, we have an evidence-based care transition model that's designed to reduce hospitalization rates with protocols to help people go on. That's going to be a feature that Love Thy Neighbor is going to have access to help people with their care transition. So again, if we can get enough volunteers, if we can get enough money raised, then we'll be able to add that care transition plan to anybody who's transitioning out of the hospital to help. It's just going to help supplement the things that are already in place. It's not replacing those things, it's supplementing those activities. And then the team-based model. We need to create an interdisciplinary team that is comprised of you guys. And in order to be successful, it's going to take a lot of work from the entire community, right? So all of this is going to be done in partnership with you, our service providers. It truly is neighbor helping neighbor. It's not one company, it's not one entity taking on that task. If we rely on one entity, Love Thy Neighbor, to take on this entire task, it's going to fail, right? Because these problems that the elderly face are complex, they're hard, and it takes a village, right? So what we're going to be looking for with these service providers and this renewal of building up our service provider group is we want active participants involved in helping push the foundation forward. What we don't want, and I'm going to be blunt on this, and I apologize, but we don't want referral collectors. I've done something similar to this in Colorado. I was part of the Fall Prevention Network in Colorado. We got a grant and money from the CDC to put together an information and resource hotline and volunteers to do exactly what we're doing here. Worked great, had a great, the CDC recognized us for being one of the best fall prevention programs in the country. It was fantastic. One of the things I learned from there is there's two different types of volunteers. There's volunteers that step up and help and do the work, and then there's volunteers that want to be part of the collective referral. And what I've seen is these volunteers that step into the work do 80, 90% of the work, but it's 5% of the volunteers, right? And so we're going to try to change the mindset. If we're going to volunteer to be part of Love Thy Neighbor, we have to change our mindset a little bit if we want this to work, right? So what services and what exactly is Love Thy Neighbor going to do to solve these problems, okay? First of all, we're going to do exactly what we've been doing for the last 6-7 years, which is we're going to have the information and resource hotline. We currently have an information and resource hotline being answered by a case manager. You guys want to make a guess who that case manager is right now that's answering it? That guy back there. Something you guys need to know is the executive leadership team, Randy and the work he does, the work I do, Mary, Al, Allie, all of this, we're volunteers. Right now, we're just 100% volunteer driven. There's zero, next to no money budget for what we do right now. But we can make this fantastic and go that route with your guys' help, right? So we have the INR hotline. We'd love to increase the calls to the hotline, and I'll tell you our plan for that in a little bit. We have workshops, which prior to COVID, Al was getting 100, 150 people at these workshops, community people. That's not the service people, the healthcare workers or company representatives. That's community people at these events. They have not had a workshop really since COVID hit. And our first workshop since COVID is going to be a week from today, July 13th, at Victory of the Lamb Church, which is a normal place that we used to have it at. So we encourage you guys to, I'm sure you guys have seen the emails already to register for that event. But please spread the word also to the community so we can get as many people there as possible. With more funding and or more volunteers, part of our plan is to increase care and case management to go beyond just the single phone call they get when they call the hotline. We want to do more virtual and or in-person care management, helping people through the complexities of whatever they're faced with. None of this stuff is free, right? People have got to do it, and people have got to, we have jobs, right? So we've got to make sure we get enough funding to do some of these programs. The next is the care transition services, right? Like I mentioned before, if somebody goes into the hospital or they go into rehab, we want to physically go to the hospital and work with their discharge planner and help them create a better discharge plan from whatever they're discharging from, as well as do the follow-up that's required in all those protocols from that study I talked about, do those protocols to ensure that they don't end up back in the hospital. We want to train the workforce and create, because with all these people turning 65, 75, and 85, we need workforce to help work with them. So we want to create a workforce development program, again, with funding, where we're going to offer training programs and scholarships to the workforce. It could be family caregivers, it could be whoever, but we want to try to offer scholarships to send people to CBRF school or CNA school, or maybe we create our own training. I've got a lot of training already in a university that we can tap into if we need it to. And then one of the things we talked about as a group is assistance funds and grants. So we want to give money back to the community. Low-income people in particular, we want to find, if somebody needs help paying their electric bill, if somebody needs groceries, if somebody needs a walker, a wheelchair, if somebody needs home care, if somebody needs whatever the case may be, if we have enough money raised, part of our plan is to provide those assistance programs and funds. The Village program or approach we're going to take is a person-centered approach. As you can see, all the services we provide and everything we've been talking about so far is really just centered around helping that individual person solve their problem. As we all understand, no two people have the same problems necessarily, right? We can't just fit everybody into a box. Taking this patient-centered approach will provide increased focus on comprehensive care coordination at a community-based level. It'll increase community-based programs that will be needed at a time when funding has been cut for some people, right? If we can connect them with there's a million free resources out there. Her workshops, for example, free resources people can turn to. They just don't know about them. How do we get the word out? This approach with the Village is we can provide a connection to a wide array of support services. All of you people, we provide that connection within the community, and it gives us an opportunity to build connections and promote health and wellness and prevention, right? And hopefully it'll provide enough volunteers to help assist all of you guys, right? There's a lot of things that we can do if we just had more help. The more volunteers we can raise, the more you guys can tap into those volunteers, right, to help address the needs of the community. So the guiding principles of this model is really to be a grassroots, membership-based program based on volunteers, fundraising, and corporate sponsorships to manage operations and sustain it financially. Our role at the leadership, executive leadership role, is not to make decisions and move this forward. Our role is to be facilitators and to give the tools to the community. Our goal is to be a 100% transparent program that is operated, funded, ran, and managed by the community. It's not saying, oh, that person runs it or that person runs it. Now, there might be employees that helps manage that, but we truly want to have this be a program where everybody has a voice. Everybody has a say in how things are ran. But it's going to take time to build that, obviously. So we need to coordinate. So our guiding principles is through volunteer-based, coordinate services to our members by avoiding duplication of services, and vetting quality service providers. You know, we don't want to be someone that says, here is a resource guide, go choose your home care agency or go choose your nursing home, right? We need to, and Al's vision is to be somewhat like an Angie's List, if you will, right? An Angie's List, but better. The problem with Angie's List is anybody can be a member of Angie's List. There's no vetting there. There's nobody holding people accountable to quality, right? Part of our goal, part of Al's goal, is to be an Angie's List-like service for not just this community, but other communities across the country. We've got big goals. Another guiding principle is to maintain a holistic and person-centered approach that's consumer-driven, that prioritizes the individual's overall health and well-being. It's about doing what's right for everybody, not what's right for your company sometimes, right? I got out of the corporate world. You know, I was in the corporate world for many years of my career, and I didn't like what I saw because everything was money-driven, financial-driven, and it was not person-driven or care-driven. And I feel that's a part that's missing in our community. And that's why I got out of the corporate side and started my own company. And there's more reasons. If you go on our website and see the story of my mom, you'll see why I started my company. But it truly has to be holistic, and everybody has to have the same mentality of let's do what's best for everybody. And then we need to promote active involvement and civic participation, right? My goal is with the volunteers that volunteer, they're doing so because they're not necessarily saying, I want a referral from my neighbor. Will that happen? Yes. Being involved with us will help you grow your business. Yes. But you have to have, you or your company has to have a civic-minded, altruistic motive of, I want to give back to the community. I want to be part of the solution. That's the mindset that we need to have as these volunteers come together. Not the, I want to be volunteers just so I can raise my, raise money for my company or get referrals, right? The referrals are going to come, depending on your service provider and what you guys do, you might not get a referral every month or every year, right? Your referrals are going to come from oftentimes being part of the committees and working with all the other service providers, right? It just depends. Now, our goal is to do a ton of advertising, and we will have, at some point, hopefully, dedicated people out there to drive referrals to the hotline, right? And we want to actively look for referrals for hearing, referrals for your video program, referrals for Medicare insurance, referrals for home care and home health and assisted living. We want to drive those because I understand, if your bosses or your company, if you want to be involved, you still have to, it has to be some sort of benefit for you guys. I get that. But my hope is to tap into the side of businesses that say, yes, I want to donate, or yes, I want to volunteer with and give back to my community. So how do we build the village? This is a complicated mess. And it's under construction. You know why it's under construction? Because we need your help in building this, right? We're not, you know, while we are highly educated people, we don't have all the answers all the time, right? We need your help to build some of this. So we have the executive leadership team that it consists of the 4 of us currently. We're looking to build an advisory board that's going to help advise us. But the advisory board, we're going to be very picky and selective as to who we bring onto the advisory board, because we hope they're going to get us into the right people and the right companies within the healthcare community within the Milwaukee area. So for example, we're going to target people like Maria Ledger from, she's the CEO of Family Care. My Choice Family Care, really. She's the CEO of My Choice Family Care. So, you know, I could see a vision where adding our hotline and adding our services to what they do at their MCO could be highly advantageous to them. We have a meeting coming up soon with Dr. Frank Lavora, the Chief Medical Officer at Aurora Healthcare Systems. You know, we're going to target him and see, hey, would you please come and be on our advisory board and help us get better connections to spread this program. So you can see, and all the advisory boards we bring on board, you guys might have better ideas. Help us recruit, help us figure out strategically who are the right people we need, the powerful people, the people who movers and shakers that can get us connected and get us in, you know, I think our Love Thy Neighbor Foundation and the services we provide can be beneficial to anybody out there because we're free service. Right. Then we're going to have a steering committee. Now, the steering committee is people who come together that help prioritize and make the decisions. The steering committee basically is going to be the brains, you know, the managers and people who hold us accountable to moving Love Thy Neighbor. And so that's going to consist of some of the stakeholders, the people who stakeholders are people who have an interest or have a benefit from the partnerships. And so they could be service providers, the community end users like the seniors themselves, and the community members. The steering committee is also going to be comprised of at least one person from these committees, and I'll explain these committees in a second. So in order to move this forward, you know, particularly when we have a very, very no budget, we need people to help us in various aspects to move this forward, which means we have committees that are going to help try to move this forward. The scholarship team and committee, when we have money, will be people who approve the applications and give out the actual scholarships. The public education team is the team who's going to organize, set up, and run all of our public education workshops. Right, finding the spot to have them, setting them up when we do them. Thankfully, thanks to Eileen and Al, we actually have a manual on exactly every step on how to run a workshop. Marketing and outreach team is going to be responsible for helping us increase the call volume to our INR hotline. Who do we need to target? Who do we go in front of to get referrals to our hotline? How do we spend our marketing and advertising budget? How do we spend our money? How do we get ourselves out there more how do we get, you more referrals? How do we get you more referrals? How do we get you more referrals? We're going to work collaboratively as a team. The fundraising team, self-explanatory, but it's basically, helping us identify grants. We will have grant writers, or hopefully we will have grant writers who will help us do it. We just need help identifying where's the grants or who are the corporate sponsors that are willing to donate to this. And can we put on a golf tournament? Can we put on some sort of fundraiser in addition to continue to raise money? The last thing is we have the service provider oversight team. This team is going to do exactly what it says. It's going to provide oversight, holding accountable the service providers to quality care and quality services. And it's also going to be responsible for picking who the team is going to be responsible for picking who is the service providers within the network. All of this is under construction, meaning we could change it. If you guys have better ideas, like, oh, let's do it this way instead of that way, we're open to those ideas. But the idea right now for the service providers is we're going to have two different types of service providers. We're going to have our in-home service providers, which those service providers are those who provide care in the home. You go to the client's home, in the elderly home, and help them. Then we're going to have what we call at-location service providers. You know, an assisted living would be an at-location service provider because the people move in there, right? A DME store might be an at-location service where somebody has to go to the store to pick up whatever they need, et cetera. For the at-location service providers, we're going to have an unlimited number of service providers in that category because it's going to be hard based off of geography to do all that. But we will, our goal is to work through and vet every single person, every single provider. Those who vet, we'll talk about vetting in a second. For the in-home service providers, anybody can be a service provider on that. We can have unlimited service providers. But we're only going to start, because this is a big project, a very big project, and we're limited to the number of volunteers we have, and we have no money right now. We're going to limit it to, we're going to vet out 2 service provider per category. So we are going to, so we have the information and resource hotline, but we also have a website that is built. It needs to be better, and we're working on that. But all service providers can claim a page and build themselves a profile page on our website. Any service provider will be able to do that soon. That's part of the goal. But then the vetted service providers, when a search comes up, the vetted service providers will obviously come up to the top. And then the vetted service providers will also be the ones that we recommend. And if we're going to recommend something, we want to put clout behind that, and we want to make sure and hold accountable to those people for quality of care, that they show up on time, they do what they want to do, and that they're quality service providers. No matter what category you fall in, whether you're vetted, not vetted, if you want to be on our website, you want to be on a resource list, if you want to be involved at the workshops we do, if you want to be invited to those things, there's going to be certain expectations that we have. One expectation as service providers is we want, it says you will volunteer into one of these committees. We need at least 2 to 3 people as leaders for each of these committees if we're going to be successful. This is new concept to people, and I know, I apologize. Again, we're under construction. We want service providers, like I said, to be service providers and active participants in the foundation. It's unfair to those who do a lot of work to help the foundation go, and then we have these other service providers that do nothing and just sit back and collect referrals, right? To me, that's not a fair, that's not a true partner if you want to be a partner of the Love Thy Neighbor Foundation. We want people to be present and on time. We want people to be active problem solvers. We want people to be prepared for the meetings, and if you get tasked for something and given some homework over the case, maybe please come prepared for the meetings. Communicate openly and effectively. You know, this is kind of key. Communication, this is only going to work with active participation and communication, right? We need to, if we've had an issue, a concern, a problem, we need to address that so when we leave the meeting, hard feelings go away at that point in time. Everyone must cooperate with each other and hopefully not speak ill of each other publicly, you know. In order for this to be a solid foundation that people like and love and want to refer to, they don't want to hear a bunch of complaining and infighting amongst people, right? So our goal is to love thy neighbor. You know, work collaboratively. You know, We have four core values at my company, Talon, and one of our core values is family, and we want to treat each other the way we treat our family members. Humans, when you get humans together, it's common knowledge that humans sometimes are not going to see eye to eye, right? There's going to be issues and there's going to be problems. We got to address those like the professionals we are, the adults we are, and treat them like we would our loved one. You know, communicate, have conversations. You know, sometimes my dad makes me mad, but I love him, and I just move on, and we just keep moving forward, right? We want to make sure that there's no more than 2 substantiated complaints in a year. You know, if somebody complains about this handyman guy, he's constantly late, he does bad work, we don't want that part of our system, do we? Right? It gives Love Thy Neighbor a bad name if we have service providers that we recommend who do a bad job. Now, we understand that people are going to complain. Sometimes there's customers who you can never make happy. That is a complaint that would not be substantiated. But we have 2 substantiated complaints a year will cause a problem. And if we continue to have problems with service providers, we may say, hey, you know, either fix the problem or we're going to have to find somebody else, right? That's the job of the service provider oversight team, is to do those investigations and watch those things. Got to be willing to sign a non-disclosure, non-compete, protecting the things that Love Thy Neighbor is doing, the program we're doing. We don't want to show you how to do this and then you go and do it yourself for your own good, right? We don't want to be in competition with you guys for the things we're doing. We should be doing this collaboratively and together. And there could be things that, you know, you are doing that is unique and different because you're part of the foundation, that if another service provider of the foundation does it, it detracts from you, right? And that would make you upset, right? And so we really want to make sure that we have a non-compete, non-disclosure for certain things with the foundation. And we just want to make sure that if we have people involved, that we have consent of their bosses, right? If you're going to be attending meetings every once in a while, you know, spending 1 hour a month or 5 hours a month attending a meeting or setting up a workshop or helping us approve, whatever the case may be, it's up to you if you want to volunteer after work, but a lot of people do it during work. And we just want to make sure that we have the full support of the company that backs you up. I think that's about it. Am I missing anything? You know, this truly is something that's it's different, it's unique. We're trying to set some expectations because we want, again, I've been a part of many committees where, you know, 5% of the people do 90% of the work, and that makes it really hard for an organization like this to move forward. So we're asking for your help. We want you to be part of the foundation. And again, it's all under construction. And so once we get the committees filled and we figure out who the service providers are and we start having the meetings and we start moving things forward, you know, we may find out, oh, we're going to try things this way, and then we find out, oh, that doesn't work, let's try it this way. But we're going to do that together as a team. You know, I believe in servant leadership, and that's what I do with my company. My job is to facilitate and give everybody the tools and be there to support and provide comfort to those who need it. The last thing I want to say is we have applied for some grants. We just applied for a grant for $8,000 from the Green Bay Packer Foundation. Their grant this year, they're focusing on programs for the elderly, which is good. I have another grant that I just applied for, working on applying for, to help rebuild our website. But the big news is we do have a verbal commitment from a private donor who hopefully, fingers crossed, there's no promises and guarantees, he has verbally committed to donating $1 million to Love Thy Neighbor. And so if that happens, that's not a promise yet. We think that's going to happen soon. We've been talking to the donor for like 6 months now, and we're waiting for something to happen before we can get the money. And if we can get that money, then it's going to be a game changer. And we want to advertise everywhere and really boost everything and really get this program going. But we don't need that. The money is going to be extremely helpful, but to push the hotline and push the workshops and push the care management and work collaboratively, we don't need a lot of money to do that. So the big picture, if we can do everything we want to do, I think I budgeted around $340,000 a year to do it. So that's something that's kind of a target goal every year that we're going to be looking for to raise if we want to do the full picture of the services.